Hello, I'm Laura, and for Mental Health Awareness Week I'm going to be talking a bit about antidepressants and touching on my own experience taking them to treat depression and anxiety. Antidepressants are psychiatric drugs that are licensed to treat depression and other mental health conditions such as anxiety disorders. Selective serotonin reuptake inhibitors, or SSRIs, are the most commonly prescribed antidepressants in the UK, and these can ease symptoms of depression, are relatively safe, and typically cause fewer side effects than other types of antidepressants. SSRIs treat depression by increasing levels of serotonin in the brain. Serotonin is one of the neurotransmitters that carry signals between neurons. SSRIs block the reabsorption of serotonin into neurons. This makes more serotonin available to improve transmission of messages between neurons. By causing a change to your brain chemistry, antidepressants may lift your mood. However, antidepressants don't work for everyone. Depression has many causes, and since not every case is caused by a chemical imbalance, antidepressants may not work for every individual. I wanted to talk a bit about how antidepressants have helped me, but I think it is important to stress that this is just my experience and things will be different for every single person. At the beginning of my final year at university, academic stress and a change in lifestyle impacted my mental health in a way that I couldn't really have predicted. I was experiencing a persistent feeling of anxiety, and I later developed symptoms of depression. For a couple of months I kind of waited for the feeling to pass, but it didn't really seem to be getting it much better, and it was really impacting my confidence, my relationships, and also my university work. So in December I decided that I couldn't just push through the feeling anymore, and I made an appointment with my GP to try and get a bit of extra help. I had previously taken antidepressants in my late teens to treat anxiety. However, I had found that they made little difference to my symptoms. So it was only after talking to a few of my friends about their positive experiences taking medication that I really started to reconsider it. Speaking to my GP, they recommended some initial talking therapy as well as other lifestyle changes. When proposing treatment for anxiety and depression, GPs will always recommend alternatives to medication first, as per the National Institute for Care Excellent guidelines. After this, we decided that I would try an SSRI that was different to the one I had taken previously. Now, after 5 months of taking antidepressants, I can quite confidently say that my quality of life has significantly improved. But before I go into the benefits of antidepressants, I think it's really important to stress two things. Firstly, medication is not a quick fix, and the changes didn't happen overnight. For most people, it can take weeks and months before any kind of benefit is felt. And then secondly, alongside taking antidepressants, I have attended talk therapy. So whilst antidepressants can quickly work to reduce the symptoms of anxiety and depression, talking therapy seeks to understand and address the causes. So for me, a combination of medication and psychotherapy was very effective. The antidepressants gave me relief from the physical symptoms of anxiety, and I also experienced a general boost in my mood. I was also better able to engage with the psychotherapy, which equipped me with the tools to manage the negative thought cycles that I often fell into. I still experience days and sometimes weeks where I struggle with my anxiety and low mood. However, I am able to get through these knowing that the feelings will eventually pass. I'd say that one of the biggest differences that I've noticed is that I'm now able to practice and feel gratitude. It's the kind of feeling that you don't always have space for when you're overwhelmed by anxiety or experiencing depression. But now I'm extremely grateful every day for the people in my life, and I'm able to find joy in kind of the smaller things. Treating my anxiety and depression has given me the freedom to be myself, to be more present, and to feel genuinely hopeful about the future. So I would say to anyone who is reluctant to look for support that I think it's important to know that asking for help isn't giving up. It's actually refusing to give up. Looking into any kind of treatment for your mental health is an incredibly powerful step. It's showing yourself that you are worthy of getting better. Thank you so much for listening, and for more information on how to support your mental health, please visit www.hfehmind.org.uk.